I came to Dr. Jati in October. I'd been bleeding for 11 days, and not just a menstrual bleed, but a heavy flow. We describe it as a bloodbath for 11 days. And because I wasn't in pain, I didn't take it that seriously. But when he saw me, he said, get straight to the hospital, and he told me have them get the bleeding to stop immediately and get an MRI. Well, when I got to the hospital, they wouldn't help me. They wouldn't touch me at all. They finally did consent to giving me ultrasound, and from that we realized that I had uterine tumors, fibroid tumors, and so we started treatment. And I had a few dietary changes, not much, and I complied with the diet and with the procedures. I started having my procedures with him and been following it now. It's been like 4 months, and things are going good. From what we can tell, the tumors have shrunk down to the size of flat little almonds. There was about 5 or 6 of them, some in my uterus and some on the outside. I've been seeing Dr. Jati, first of all, for 7 years with my maintenance, maybe every 2 to 3, sometimes 4 months, depending on how good I felt. Yeah, I had come to Dr. Jati. I had started my period, and it was what I thought was normal. But I hadn't even had one for 5 months, which happens to me when it gets hot. I will stop having a menstrual cycle. But it started, and it never stopped. And after 3 or 4 days, I had an accident where I just tumbled down 2 stairs at the house. And that day, I just started bleeding a lot. And I didn't think of it too serious because I just thought, well, maybe I thought my uterus was purging after 4 months of not having a menstruation. So after 11 days of that heavy bleeding, I got concerned and came to Dr. Jati, and he was like, this is serious, get to the hospital, have them stop the bleeding as soon as possible, to have them do an MRI, and go now. That was his instructions, was to go now. I got to the hospital, and they finally did see me. Because of my history, they did not want to help me. And even though Dr. Jati had told me to tell them to give me some sort of shot or medication to stop the bleeding as soon as possible, they refused. They didn't want to give me the MRI either, but they finally did give me a ultrasound, and that's when they found out that I had tumors, and tumors like the size of oranges. And so when I got the paperwork back, well, at first, when they had told me that they weren't going to help me with the bleeding, and they were like, we can't really help you because of your history. And then it was like, I was told the doctor, well, if you were bleeding, if this was a male part bleeding, you would want it to stop today and you'd figure out a way. And then after that, I did not allow him to touch me or examine me because I felt like he didn't really care about me, the person, just my symptoms. And so I did get an ultrasound, and he did lie in the report and say that he examined me and that we discussed my options, which there were no options, and sent me on my way. But I did come back with the results, and from that point on, we started treatment twice a week with my procedures. He did say the type of procedure that he was doing was actually to balance out the hormones and also aid in the connection between the brain and my uterus to get these tumors to start to shrink. After having an ultrasound, the sizes of them were the size of like small oranges, like 6.5 to 7.5 centimeters, and roughly about 5 of them or 6 of them, depending on where they were located, if they could be seen and felt. So we started the procedures on them, and it's been about 8 weeks now, and they have shrunk down. I'm glad to say they are now the sizes of almonds, and they're flat, which means they're deflating and they're dissipating, and my body's getting rid of them. And we're hoping that in another week or 2 that they'll be gone, completely gone.